Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
I'm not upset that he didn't get it. I'm just sad that he died from COVID.
A mourning mother makes a plea to get people vaccinated.
We normally see it, though, in kind of kids in daycare, under a year old, and generally from the months of like October to May, kind of your stereotypical flu season.
Another virus threatening children.
They leave empty-handed, which was, I think, a shocker.
The veto blow for the GOP.
I think that we are going to continue to have a hard time.
Questions looming about the veto override session's impact on our state.
Hi, everyone. I'm Kara St. Cyr.
And I'm Andre Morrow. Health leaders say the unvaccinated are fueling the surge of new COVID cases throughout the state. Their numbers, Governor John Bel Edwards says, took his breath away. Wednesday of this week saw more than 5,000 new cases, the third highest day since the pandemic began.
The governor says that we've lost 4 months of progress as we head into this fourth surge. He said, quote, "There's no doubt that we're going in the wrong direction and we're going there in a hurry." There is a small silver lining, though. Dr. Catherine O'Neill with Our Lady of the Lake Hospital says that we're seeing the vaccination numbers go up slightly with the number of cases we're getting, but it still isn't enough to keep us out of this fourth surge.
Here now is the latest from today's COVID press briefing.
Because of the troubling trends, we are issuing some updated additional guidance today to the public. First of all, we're recommending that all people, vaccinated and unvaccinated, mask while indoors if 6 feet of physical distancing cannot be maintained. Second, we're asking that businesses review their operations and accommodate employees in a way that limits contact and potential COVID exposures. Third, we recommend that all people, even vaccinated individuals, test immediately after a known or suspected exposure to COVID-19. If positive, you should isolate immediately. If negative, you should retest again between 5 and 7 days after the exposure, or if you develop symptoms, you should test immediately pending the results.
And now we got more news making headlines across the state. UL Lafayette is encouraging students, don't wait, vaccinate. Fully vaccinated students will be eligible to win 1 of 10 prizes in a series of drawings that begin August 10th. School President Dr. Joseph Savoy says vaccines are free, they are safe, and they are the best shot we have to end the pandemic. New Orleans city leaders issued an advisory Wednesday strongly recommending that people resume wearing masks indoors, hoping to avoid the kind of virus-related shutdowns that crushed the city's tourism economy in 2020. Mayor LaToya Cantrell stopped short of requiring mask wearing, saying the advisory puts the responsibility on individuals themselves. 10 Louisiana residents are accused in scams that defrauded pandemic unemployment programs in our state and in California out of more than $1 million. Multiple groups allegedly conspired to rip off the unemployment insurance and employment development programs. The Army Corps of Engineers ignored its own operating manual when it twice opened the Bonnie Carey spillway near New Orleans in 2019. That's according to Mississippi's Lieutenant Governor, who says it led to an environmental and economic disaster with endangered sea turtles. The National Audubon Society is merging its Louisiana, Arkansas, and Mississippi offices into a regional office called Audubon Delta. Audubon leaders say the merger will help galvanize the great work happening with bird conservation in the region and in North America. The historic veto override session we've watched unfold over the last week ended on Wednesday. Out of 28 bills that the governor vetoed during the regular session, none were overridden. That's including the Fairness in Women's Sports Bill and the Concealed Carry Bill.
Both proposals gained significant support in the regular session, but were just short of the votes needed to officially overturn the governor's decision. This historic session was the first since Louisiana's modern constitution was adopted in the 70s. The governor said in a press conference that he would continue to work with lawmakers despite any disagreements.
I'm going to wake up tomorrow and I'm as willing to work with anybody as I was earlier today or last week or last month or last year.
With no veto overrides, it was a major blow to GOP efforts to assert independence from our Democratic governor. I tried to talk with House Speaker Clay Schexnayder, but I didn't hear back from him. I did sit down with political expert Greg Hilburn of USA Today Network.
Most people don't realize, but veto override sessions in the Constitution are automatic unless lawmakers opt out. Well,
so explain it to me, automatic.
So it's set. The veto session is set after each session unless lawmakers decide they don't want to come in. So they have to actually send in ballots saying we don't want a veto session, and a majority of them have to do that for it not to happen.
And that's what's always
That's
happened.
what's always happened in the past.
Okay, but this time
This time, no. In fact, it was overwhelmingly the legislators decided to come in, have this historic veto session.
Which seems like a lot of strength for the speakers.
For the speaker and the president
versus the governor.
Right, and all of the Republican leadership advocated for this veto override session. And right now in the legislature, you have a big, the balance of power is split between the legislature and the executive branch of the governor. The Republicans dominate both the Senate and the House, and then you've got this anomaly, a Democratic governor, and of course Governor John Bel Edwards, the only one in the Deep South.
Right, exactly. And in this case, you had two really controversial subjects.
The two top targets was a bill to ban transgender athletes from competing on girls' sports teams, and the second one was a bill that would allow concealed carry of a handgun without a permit or training. Right now in Louisiana, as you know, you can carry a gun on your, in a holster, open carry, walk down the street with one, and concealed carry is available to you, but you have to have a permit and training. Right. So those were the two targets, and I think that the most likely override would have been the transgender bill, because 78 people in the House voted for that bill during the regular session, and an override takes 2/3 votes, which is 70 in the House.
They go through all this work and this extra session, and nothing is overridden.
No, they leave empty-handed, which was, I think, a shocker. It was going to be tight, but in the Senate, the gun bill did not get enough votes, 2/3, which is 26 votes in the 39-member Senate. But the transgender ban bill, which was Senator Beth Mizell's bill, it did get the exact number of votes. It got 26 votes. 26 votes. So it cleared the Senate, and then it went to the House. Well, in the House, there are not quite a supermajority of Republicans. There's 68, need 70, but they were confident because of there were quite a few Democrats voted on this bill during the regular session. Mm-hmm. But in the end, the governor's power among his delegation, the Democrats, it held. So in the end, 68 votes, 2 votes short, and after that, no other bills were heard. It was clear that there were going to be no vetoes.
Maybe an embarrassment for the speaker and a big victory for the governor.
A big victory for the governor. He used all of his power, all of his resources, all of his carrots to make this happen. He has been putting on a full court press on his delegation on the Democrats and some Republicans to prevent these overrides, which would have been the first. There have been a couple of veto overrides that happened in the 90s, one with Edwards and one with Governor Romer, but they were while the legislature was still in session. It wasn't during an override session.
What does it mean right now, and then what does it mean going forward?
It showed that still, even though the legislature is dominated by Republicans now in Louisiana, there's still that 2 votes short of a supermajority in the House. It showed that the governor can hold that line, which is especially important, maybe not for individual bills, but going into next year, Andre, as you know, we're going to have redistricting. And what that means is every 10 years after the census, every state redraws its political lines. The districts in which the lawmakers serve, the congressional districts, right, which is hugely important. Now that's late this year because of the pandemic. Normally that would be happening this fall, but now it looks like it's going to happen in January or February of next year. Well, the governor also has veto power over that map. So it shows that the governor will have a say in this critical redistricting process, which is, I think, hugely important because that's the map that we'll go by for the next 10 years.
What does it say for the speaker?
The speaker, Clay Shake Snyder of Gonzales, he's a Republican, but he will now face some enormous pressure and criticism. Immediately after adjournment, the Republican Party of Louisiana sent out a press release, an email saying that they demanded that he immediately remove any Democratic chair of a committee that he has appointed, and he has a few Democratic committee chairs. And if he didn't, there was a not so veiled threat that there should be changes in the operation of the House, which means they would advocate perhaps for his removal with another Republican speaker. So it definitely will have repercussions moving forward.
Though none of the governor's decisions were reversed, some organizations feel that even if those vetoes weren't overridden, the session itself could cause a big problem for the hospitality industry in Louisiana.
This override veto session was unprecedented. Lawmakers gathered to overrule several bills the governor didn't sign, with 2 in particular garnering the most interest: the concealed carry bill and the Fairness in Women's Sports bill.
But we have a process here in Louisiana, and the Constitution calls for a veto override session automatically 40 days after the conclusion of the regular session, unless a majority of members in either the House or the Senate return their ballots saying otherwise.
Though both bills got a lot of support initially in the first legislative session, conservative lawmakers couldn't bring in the same support for the historic override session. The concealed carry bill died in the Senate, and the Fairness in Women's Sports bill died in the House. But even as protesters and organizations rejoice over the news, they're still worried about the impact, especially because the Fairness in Women's Sports bill was on the agenda.
By getting this far, I think it contributes to a negative stigma that Louisiana has around the rest of the country as being very regressive in its approach to cultural issues in particular.
Peter Robbins Brown says that we could see that negative impact in our economy. He says one of 2 things could happen. Organizations and big names could refuse to bring business here, or Louisiana's population could suffer because less people will move in and more people will move out.
They decide to locate based on things like quality of life issues, healthcare, education, infrastructure, but also based on the public relations side of it, and as long as we continue to push these kinds of policies forward, I think that we are going to continue to have a hard time becoming a state where businesses want to come, where economic opportunity is everywhere, and our people can flourish and find good jobs.
When other states pass laws that some corporations see as discriminatory, they move their business to other places. We've seen this type of move in Louisiana too. The NBA All-Star Game was moved to New Orleans after North Carolina passed an anti-transgender bill. Next year, Louisiana is up to host the NCAA Final Four.
The most immediate issue is that NCAA issue and other potential sporting events, but I think it speaks to a broader problem that we have with attracting and retaining businesses and just, our own talent in our state.
Robbins-Brown says that this could be at risk because of this recent veto override session. And he isn't the only one. Paul Arrigo with Visit Baton Rouge says that he's seen this happen before.
In this business for almost 50 years, and I can tell you, when I was working for the New Orleans Convention and Visitors Bureau, we had economic boycotts from organizations that decided not to meet in New Orleans because at that time, Louisiana had not ratified the Equal Rights Amendment, which was in the late 70s on to the 80s. I can recall when I was with New Orleans, some organizations decided not to meet in Louisiana because the possibility of David Duke becoming governor, that was many, many years ago. Economic boycotts are nothing new.
But not everyone feels this way. Gene Mills with the Louisiana Family Forum thinks that people may leave because the Fairness in Women's Sports bill isn't in place.
This never was a transgender bill. This protected fairness in women's sports. And I think they're going to continue to see that migration.
Mills thinks that people in Louisiana who don't agree with the bill may go to other states like Texas, who do have this legislation in place. He also thinks that the session's topics will pop up again next year.
This issue's not going away. It will be back, and I predict it will be successful in the future.
It isn't clear what standard this override veto session will set in the coming years, but Robbins-Brown, Arrigo, and Mills say they're looking forward to what's next.
House Speaker Clay Scheck-Snyder said he was disappointed by the loss, but encouraged by the legislature's show of independence. In the midst of another surge of COVID-19, hospitals are being overwhelmed by another virus. Children are catching RSV at much higher rates than normal. Family medicine physician Rachel Kermis says that reopening may have something to do with the outbreak.
While doctors scramble to shutter COVID cases, another outbreak is happening quickly. Children are catching RSV.
We normally see it, though, in kind of kids in daycare, under a year old, and generally from the months of October to May, kind of your stereotypical flu season.
This year, Dr. Rachel Kermis, a physician at Baton Rouge General Hospital, says we're seeing those cases soar ahead of schedule. Like Kermis said, this virus usually pops up in the fall and winter time and dies out toward the beginning of summer. But right now, southern regions are seeing an influx of new cases. More children are outside and in daycares, where most haven't been in over a year. And to make matters worse, adults are also catching the virus from caring for their sick children.
Right now, though, because we're kind of opening things back up, we're seeing a bigger increase in it. So we're actually getting RSV season now instead of when it would normally happen. I've even heard of some daycares in St. Francisville that are kind of being shut down to get a deep clean so that we can stop it passing amongst the kids. So it's definitely a problem that is creating a kind of a stress on the public health system right now.
The symptoms are similar to COVID in that you have a cough, shortness of breath, and a fever. You can catch it from droplets in the air or from touching contaminated countertops.
A lot of it is kind of like a common cold, especially for adults. Adults kind of have it mainly stick in their upper respiratory tract. And when we say that, we pretty much mean throat on up to ears, nose. And unfortunately, though, in kiddos, it can become a lower respiratory tract infection. So that's down into your lungs, into the tubes going into your lungs. And even in some people with kind of immunocompromised state or who have pre-existing health conditions like asthma, COPD, they can have it progress also into that lower respiratory issues, which can sometimes develop into a viral pneumonia or a bronchiolitis type of picture, which is inflammation of those tubes going into your lungs.
If it goes untreated in babies and small children, it can be deadly. That's why Baton Rouge General and other hospitals like Our Lady of the Lake are opening testing centers outside, which is a lot similar to what they did for COVID in the early months of the pandemic. It's a way to get people help fast, but it's also a way to keep healthcare workers from getting too overwhelmed. Dr. Kermis says that this month alone, she's seen 15 patients with RSV compared to the 1 or 2 she'd normally see this time of year. That, along with COVID, has been difficult for hospitals to manage.
We didn't always have the RSV testing at the urgent cares, to my knowledge, but since we started seeing an increase in the number of cases, we have been having it there, or at least we're more readily stocked with the testing agents. A lot of pediatric offices have RSV testing at them, but it definitely is something that the urgent cares didn't always have and weren't always testing adults for. Normally with adults, you kind of just have a cold and your body fights it off. But because we are seeing such an increase in the number of cases within the community, we have started testing more than just those young kiddos with it.
Dr. Kermis says that wearing a mask and keeping the same hygiene practices that are encouraged with COVID are the best ways to keep you and your children safe.
If you think your child has some of these symptoms, please schedule a doctor's appointment and get tested. Dr. Kermis says this virus is very contagious.
A memorial service that gave people the opportunity to get the COVID vaccine right there at the service took place this past Sunday in Port Allen. Betty Antoine is the person who spearheaded this. Betty, you're here with us now, and you did this because of your son who died of COVID and did not get the vaccine.
No, Brandon did not get the vaccine. He said not enough research had gone into it. So Brandon had a lot of friends who believed in him. He was the guru of the group. And what Brandon said, they did. So Brandon told them not to get the vaccine because it was not enough research to go through. So Brandon got sick.
When did he get sick?
He got sick probably June 4th. He called me up to come to help him clean. So when I got to his house, I said, Brandon, someone has cleaned your house. He said, I just want my bed done. So I walked out of his bedroom to get something, and he called me in, and he said, Mom, you need to call the ambulance. You need to call 911, which was very unusual. Brandon would go to the hospital 2 or 3 times a year because of his underlying problems.
What were his underlying problems?
He had heart problems. The left side of his heart was damaged. He had lung problems, COPD. He had gone blind in one eye, whereas he had fluid behind the eye, so he had to have a operation done. It was a New Year's of 2015. So he had a lot of things going on. He was on oxygen constantly.
A history of underlying conditions. So someone who was certainly the type of person who would be first in line to get the vaccine because of his illness history. And yet,
he didn't want
a guru against getting the vaccination, like many people are. Only 40% of people in Louisiana have been fully vaccinated so far. And that has been able to allow people to get sick again with a new variant. And those people can get the people vaccinated sick again.
That's right.
And we're back at square one, which is where we don't want to be.
That's right. The morning Brennan died, I had gone home the night before because his stats were looking good. I mean, his oxygen level, everything. So they told me to go home. The doctors told me to go home because I was staying up there almost 24/7. But the next morning, the nurse called and she asked me, was I in the waiting room? I said, no, I'm at home. She said, well, are you coming up? I said, yes. She said, do you have anyone with you? And I said, no, but I'm coming. So I got up, got dressed, got on the interstate coming from Denham Springs, and you know the traffic. And the doctor called. He said, are you on your way, Miss Antoine? And I said, yes, I am. And I said, why? Has he died? He said, no, just come on. I said, I've always been straight with you. You've been straight with me. Has he died? And he said, yes, Miss Antoine, he's dead. And I was really emotional going to the hospital.
You're driving there and hearing this.
So I get there and I see my son, who's 46, and he was still my baby. Yeah. And he was dead there. And he died from COVID. And I said, the only thing that I could do is to get the word out that Brandon died from COVID because he did not have his vaccine, and his friends and family should go and get that.
And it's amazing that you had the wherewithal to even think that in that moment and that you had the ability to carry it through with the partnership of Oxnard Hospital, who was there to provide vaccinations, but still the strength to do this and the purpose to get the message out, because Brandon did not get a vaccine.
He did not, and again, his friends believed everything that he would say because he would investigate everything. So they said, Brandon said not to get the vaccine, we're not getting the vaccine.
How many people do you hear say, oh, I heard this, saw this on Facebook, I saw this on Twitter, my so-and-so said this, so I'm not getting it, instead of necessarily looking at what the science is being said?
So after that, a lot of his friends before the memorial had gone out to get the vaccine. They would text me their card, Miss Betty, I've gotten it. You see, my friends were Brandon friends, and Brandon friends were my friends. That's how we got together. So I'm glad that they are going out to get the vaccine.
So one thing that's important about this is that your message, the service, was picked up by Louisiana's largest newspaper, The Advocate.
That's
so that
right.
It was reported. CBS News is following you around, doing a report on you.
Yes.
I ran into you at Whole Foods. That's how I found out about the story and brought you in here for our interview. So your message is getting out.
Thank you.
And that's great. That was what your purpose was.
That's it. That's it.
What left could you do, right? What else could you do?
I can continue to tell people to go out and get the vaccine, because my son died from not getting the vaccine. I'm not upset that he didn't get it. I'm just sad that he died from COVID. I'm sad. And I don't want anybody else who can get the vaccine not to get the vaccine and then die.
Betty Antoine, thank you so much.
Thank you.
I appreciate it.
Okay.
And everyone, that's our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our LPB app.
You can catch LPB news and public affairs shows, as well as other Louisiana programs you've come to enjoy over the years. And please like us on Facebook, Twitter, and Instagram.
For everyone at Louisiana Public Broadcasting, I'm Andre Morrow.
And I'm Kara St. Cyr.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.